As you're getting your kids ready to head back to school, medical professionals recommend adding the HPV vaccine to your to-do list. Nearly 40,000 people are diagnosed with HPV-related cancers each year. If children are vaccinated, though, the CDC reports 90% of HPV cancers can be prevented. Joining me is Dr. Keegan Kavanaugh with Mercy Pediatric Clinic. Dr. Kavanaugh, thank you so much for joining us today. We appreciate it. Let's start with just how common is human papillomavirus, or as it's more commonly known, HPV?
Yeah, HPV, it's very common, would be the short answer.
Okay.
It's estimated that 80 to 90%, if not all, adults will be exposed to HPV at some point in their lives, as long as they've been sexually active.
Okay.
So it's the leading cause of it's the leading sexually transmitted infection in the U.S. and globally. And so it's estimated, essentially, if anybody's sexually active, that at some point in their life, they're going to be exposed to it.
Okay, so with how common this is, what are maybe some misconceptions that people have about HPV?
Yeah, one of the first ones that I hear in clinic most commonly is that, this isn't going to affect my child because they're not sexually active. So like I mentioned, it is a sexually transmitted infection, or that's how it's thought to spread in general. It can spread through intimate skin-to-skin contact, but usually it's with sexual activity. And so the number one thing I hear is that it's not going to affect my child, because they're not doing that, or they won't do that. But the fact of the matter is the vaccine really only works if it's used before being exposed. And so the power of doing it while kids aren't at risk is the whole point, really.
Well, and speaking of that, talk about the vaccine. How does it work?
Yeah, absolutely. So it's a recombinant inactivated vaccine. So that means we have particles, or vaccine-like particles, that are part of the vaccine that then are given to the body to expose the immune system to provoke an immune response. So antibodies protecting against infection. Okay. So that's how it works. It's so the one that what we call is Gardasil, it's the brand name. That's the one that most patients are familiar with. It's a 9-valent vaccine, so that means it has strains in it against 9 of the most common types of HPV. Types 6 and 11 are what most commonly cause genital warts. Types 16 and 18 are the most high-risk kinds that are most associated with cervical cancer, other cancers such as oropharyngeal cancer, penile cancer, several different types of cancers, as you mentioned, are also included in the vaccine.
Wow.
Yeah.
Who should get the vaccine, and when should they get it? I know you said ideally before someone would be exposed to it.
Yeah, absolutely. So technically the vaccine Gardasil is approved for people aged 9 to 26. So the target audience really is adolescents, as we mentioned, because the best use for the vaccine to be effective is to do it before being exposed. And so usually in most clinics, it's being administered for the first times at age 11 to 12 on an every 6-month to year basis. And so the target audience is early adolescence, young childhood, but it can be administered as late as 26. In some special circumstances, it can be done in adults as well, up to 45 years of age.
And I just want to clarify, too, this is for boys and girls, because I know sometimes there's a misconception that this only impacts girls or women.
Absolutely.
And that is not the case, that boys can get the vaccine as well, right?
You're absolutely correct. Yeah, regardless of sex assigned at birth, gender identity, any of those sort of things, I would recommend it for everybody. There's very few exceptions as far as who shouldn't get it, which are people that have had a significant allergic reaction to a vaccine previously, specifically to HPV, and then people that are pregnant. Other than that, really anyone would be part of the target population.
And if parents have questions, they just want to learn more, who should they talk to and reach out to?
Absolutely. I would talk to your primary care provider. Most pediatricians, family medicine doctors, internal medicine doctors for older people or parents, those would be great primary places other than Dr. Google to look at first. Additional options would be cdc.gov. It's a super helpful website that's pretty user-friendly from a parent perspective. Lynn County Department of Public Health, Iowa Department of Health, our Department of Public Human Health and Services are also good online resources, all of which would be good starter places outside of the office.
Great resources out there. Dr. Keegan Kavanaugh with Mercy Pediatric Clinic, thank you so much for being here.
Thanks for having me.